All right. Welcome, everyone. This is Dr. Clark at the Center for Weight Loss Success. Tonight on Losing Weight USA, we're going to talk a little bit about growth hormone. We've kind of hit on a bunch of different hormones over the last few months. Growth hormone is a very important hormone for overall life. It's something we do require throughout our lifetime. It just tends to slowly decrease as we get older. So the question there is there a way we can manipulate growth hormone? First, we'll talk about kind of what it does, what it's made, kind of a little background on it. But also then, is there a way to manipulate it? And, some people obviously talk about supplementing growth hormone. We'll talk about how successful that is or isn't. And could it be something that potentially can help? All right, here we are at Losing Weight USA, little official welcome here. Welcome to Losing Weight USA, real-time answers to your weight loss questions, a little bit of the latest research as well as a little bit of expert advice. Gives you direct access not only to me, but you should be receiving the health tips and recipes via the membership portal. Each webinar will last about 30 minutes or so. If you have questions, just type them in during the webinar into the chat box. We'll get to them at the end as time permits, and typically we'll make time permit. If you think of something once we're all done, just give us a yell here at the Center for Weight Loss Success. The email, success@cfwls.com. Phone number, 757-873-1880. All right, let's get the thing switched. All right, hopefully it's working, and it does seem to work. Again, growth hormone, that's what I'm talking. Sometimes referred to as GH or HGH, human growth hormone. So the growth hormone studies, they suggest a huge, wide range of effects. And there's all kinds of different things that it claims it can do. And it actually can be very helpful for many of these. But basically, it can reduce body fat, increase muscle mass, enhance sexual performance, stronger bones. It can lower cholesterol, lower blood pressure, faster wound healing, higher energy levels, regrowth of some vital organs. Restores immune function, kind of smoother, firmer skin, younger appearing, sharper vision, elevated mood, improved cognition. And so wide range of things that it's advertised that it can accomplish. And part of that is there truth to all these things. Certainly hear about athletes taking growth hormone that can help with quicker healing. Obviously, it's not something that they should be taking. For most of the professional athletes, that's something that is kind of considered a performance-enhancing drug, which typically is not an acceptable thing to do. But could it be helpful for others during kind of whether they're ill, whether they're from an aging perspective? Can it help with recovery? Those kind of things. And the answer is, well, maybe. Okay. So is growth hormone really is it the fountain of youth, or is there more to it than that? Okay. So growth hormone is a hormone. Okay. It's made by the pituitary gland in your brain. Okay. Pituitary gland is a little kind of berry-like shape, tiny little berry-like shaped. It's a little nodule literally at the very base of the brain, and it's separated into an anterior and posterior pituitary gland, and they make a number of different hormones there. So very, very important hormones. Growth hormone is one of them, but the anterior pituitary gland also makes then thyroid stimulating hormone, ACTH, which affects your adrenal glands, FSH, which is important for women in having normal cycles, luteinizing hormone, which helps for men in developing testicles and secreting testosterone, prolactin, which for women then helps with secreting breast milk after a pregnancy, and then just kind of the overall endorphins, which are kind of our feel-good hormones. Okay? So the anterior pituitary produces a bunch of different hormones. Growth hormone is just one of them. So growth hormone, it's a peptide hormone. What that means is basically it's a protein is what it is. It's a peptide hormone, which means it's made out of amino acids, okay? And it's a hormone that stimulates growth, just just like the name implies there. Again, it's made by the anterior pituitary gland. It's 191 amino acids, single chain polypeptide, which means like a string of beads, but it has all these little side connections to itself. So it's kind of full. It's not just one long string. It's kind of wrapped into it in the way it holds together. It's often abbreviated as HGH, which stands for human growth hormone. It is a prescription drug that can be used for deficiency syndromes. So if there truly is a growth hormone deficiency, and this would be diagnosed typically in childhood. Okay? So growth hormone deficiency, the child isn't growing normally, then potentially it can be utilized. It's an injectable hormone, so it's not like something you take a pill for. Okay? And then there's also thought, could this potentially be used for age management, keep us younger? And this is where it becomes much more controversial. So growth hormone can be obtained by prescription if somebody has a true deficiency syndrome. And so then how is it actually obtained for those that don't actually have a prescription? Or are they getting a prescription under other pretenses that kind of someone is being called that they have a growth hormone deficiency, and they may or may not actually have that? All right, so, it's one of those things that it's not really easy to measure. And part of the reason, it's not like we can just draw your blood and, okay, how much growth hormone do you have? And the reason is because it's released in a pulsatile form. And is typically only released in a very short period of time. And it's usually during the early hours of the morning in your deepest sleep. So it's most of the rest of the day, there's not a whole lot of growth hormone released. Okay, so it's really kind of the deepest sleep, early hours of the morning. So it's in that 3, 4, 5 p.m., 5 a.m. in a time when we're typically in our deepest sleep, and that's when it's released. You'd have to draw it the right time frame to kind of get accurate. And the real question is, okay, what's the right time frame? Because it's a very short period of time. That is, how can you actually diagnose it? Well, part of that is that because once growth hormone is produced, it travels through the bloodstream, it's taken up by the liver, and subsequently converted to other growth factors. And the big one is insulin-like growth factor 1, or IGF-1. And so typically when someone is trying to diagnose that someone has a low growth hormone, what they'll actually measure is IGF-1, which is easier said than done, but still that's what they measure. And it's, since growth hormone actually is a very short-acting hormone too, not only is it released in just a pulsatile form, very short period of time, but the half-life is very quick too. So you'd have to catch it all at the right time in order to actually be able to measure it. Well, insulin-like growth factor then has a longer half-life to it. And so subsequently then it can be more easily measured. Now, things we do know is that growth hormone does decline with age. Typically, it kind of slowly goes up during adolescence, and then it's going to decline as we get older. And when I say get older, typically there's going to be a loss of about 1 to 3% per year after the late 20s, early 30s. Okay, for women, maybe a little sooner than that. So basically, kind of that's part of the reason why I say an athlete's prime may be in their late 20s, not really their early 20s, really probably their late 20s. So and that's typically when their growth hormone is actually the highest there. So it does decline with age. That's a natural part of aging then. And it actually can decline significantly. Now, it's also a hormone we really can't live without, so it's not like it goes down to zero or anything like that. But typically after those kind of that early, kind of mid-20s, it's dropping down fairly significantly, again, up to 3% per year. It doesn't take many years then to get fairly low growth hormone levels. All right, so what are then some signs of low growth hormone? Okay, that's really what we're talking about. Someone's looking for, gee, do you have a growth hormone deficiency? Well, unfortunately, the signs of low growth hormone are really vague. Okay, for a kid, it's going to be they're not growing like they should. But for as we get older, then it's just okay, is someone's growth hormone too low or not? But all the signs there are really, really vague. Premature aging. What the heck does that mean? Flabby, obese, stretch marks, droopy eyelids, sagging cheeks, thin lips, thin jaw, thinning skin, loosening skin, lower arch of your foot, thin muscles of your hands, prolonged skin folds. If you pinch it, it just stays there too long. Now, unfortunately, there are lots of other things that cause all of these things. And a lot of it just goes along with normal aging. So they're really vague. As literally as we get older, we all have this, right? We've all noticed these things. So it's kind of hard to get. So what are the complaints? When someone has low growth hormone, what are some complaints? Well, unfortunately, they're also really vague. Gee, I have a poor quality of life. I just don't feel as well as I used to. Kind of lack inner peace, anxious, tendency to depression, low self-esteem, I lack concentration, self-control, kind of excessive emotions, muscle and skin are thinning, they're loose, they're weak. I'm exhausted all the time. When I work out, I get exhausted and I have a really slow recovery. I feel like I'm getting old very quickly, no libido, erectile dysfunction, I just don't sleep well. I feel like I need to sleep all the time, but I just don't sleep well. Well, these are all really vague symptoms, which can be caused by lots of different things, not just low growth hormone. So what can we do to actually test this? Again, it's kind of one of those things that's really hard to measure. Again, growth hormone has a really short half-life, and because it's released in a pulsatile fashion, there's really not a good way to time it of kind of when should you actually measure it. So measuring blood levels is really impractical and relatively meaningless. So again, I mentioned that, okay, the growth hormone can be converted then to insulin-like growth factor 1. And this can be measured, and it can be measured, but unfortunately, there's an incredibly wide range of what is normal. So it also makes it really difficult for us to know, is this real or not? Growth hormone itself can be measured with 24-hour urine collections, as you'll pass some of this in your urine then. But most labs actually can't do this very accurately. So they're just not a good way to kind of really look at growth hormone deficiency. And there are some ways, but it just doesn't work well. And if you'd notice when we talk about other sex hormones, specifically testosterone, every single one of those symptoms and signs that we talked about in the previous 5, 10 minutes, whatever it was, are all consistent with testosterone deficiency as well. So we've talked about that. Men need testosterone, women need testosterone. And it's much easier to treat. Plus, it's much easier to measure, easier to treat. And so subsequently then that may be the real issue there. And so for many people, it's probably more fruitful to measure their testosterone level, their sex hormone levels than anything, because the crossover there is so significant as far as symptoms go there. Much easier to treat and much easier to measure results, much cheaper to treat too. So what about HGH therapy? Okay, what about, gee, I'm going to get HGH therapy. And you'll hear about this from athletes that may be using it. They're not supposed to be using it. But you also see it advertised and talked about on TV and the internet. Maybe get pop-up advertisement for it. You see it in the Sunday paper all the time, looking at, gee, raise your growth hormone level. And here's a way to do that by taking this supplement, we can stimulate growth hormone. Now, just thinking about the overall picture, is growth hormone safe or not? Okay, in theory, it is safe. Okay, it's a natural hormone. It's, growth hormone looks exact. It's a bioidentical hormone. Your body makes it. It can be given to you in exactly the same form. And the answer is yes, it can be. So in theory, it's very safe. it does require to be injected, okay? Or there's some way to stimulate your body to make its own growth hormone or increase the amount of growth hormone it actually makes. Unfortunately, with treatment, okay, it can take months to actually notice any clinical improvement. And for injections, okay, it's going to be, gee, you're injecting yourself, every single day. And so they teach you inject, just like some injecting insulin, they often inject it to the belly. And so it's a similar type of concept. You got to do it every single day. It may take 6 months or so to actually notice, is there any improvement at all? And it's incredibly expensive. It can be thousands of dollars, okay, per month. So it's not like, gee, it's a little quick thing, and you don't get out of the drugstore and get a $10 thing of growth hormone. Yeah, I inject it. Okay. No, we're talking thousands and thousands of dollars for a month's worth of this stuff. And it's going to take 6 months to know, is it helping at all? Now, the flip side, what if you have too much growth hormone then? Is that a bad thing? Well, potentially, yes. We don't know whether there's, how significant that can be or not, because there aren't going to be a whole lot of studies done out there looking at, gee, if we give people really high doses of growth hormone, what happens to them? But we do know that there are people out there that make too much growth hormone, and typically that leads to giantism. Okay, people that are literally huge, and you'll sometimes may notice on athletes that have been kind of suspected of being on growth hormone that they actually start getting bigger, not just muscular bigger, but actually their jaw, their head, their hands get a lot bigger. And so potentially they're not really, most of their bones are fused, so it's not like they're growing a lot taller anymore. But they typically can get enlarged jaw, enlarged hands, enlarged feet. Their skull may actually get a little bit bigger. And the other issue then is, could it actually stimulate kind of other tumor growth? Okay? So if you have some other tumor somewhere and we're giving you growth hormone, can the hormone actually stimulate the growth of abnormal tissue? And that's a question that hasn't really been answered, whether it is by stimulating the production of an abnormal cell and then it grows, or the abnormal cells occur, in small amounts, and then it just stimulates it to grow. So two slightly different things, but the bottom line being is that it could stimulate tumor growth then, which for most things is going to be a bad thing. So then what are there that you could do to actually optimize your own growth hormone? Because if we can stimulate you to make your own growth hormone, that's the best kind of way to really kind of increase how you feel and kind of it. And there are ways to do it, okay? Typically, the ways to do it are things we talk about all the time. Strenuous exercise, good quality deep sleep, which is what we encourage people to do anyway. Protein helps stimulate growth hormone. What actually works better than anything is actually intermittent fasting. And the studies that looked at every other day fasting is that in young people that do this every other day literally can increase their growth hormone hundreds of times of what they're actually normally making. And so fasting is probably one of the best ways to increase growth hormone release. Now, you'll often see things sold as enhancers to growth hormone release. And again, they're advertised on the internet, and there are some things, and whether they work or not, maybe. So what can actually potentially really help? B vitamins, inositol is kind of like a B vitamin. When we've talked in the past about B vitamin injections, a lot of B vitamins, we do this with our B vitamin injections, they add methionine, inositol, and choline. Inositol is that kind of extra. It's kind of like a vitamin. It's kind of like a B vitamin, but technically it's not a B vitamin. But it can help with kind of energy level, supporting nerve function, muscle function. Certain minerals may help. Chromium, magnesium, zinc, iodine may actually help with growth hormone release. Okay? And then some certain amino acids. Again, this growth hormone is a protein made of a bunch of amino acids, so could certain amino acids actually be helpful? Glutamine, which you often hear bodybuilders, people who work, athletes may take extra glutamine. Carnitine, kind of same thing, arginine. So there are a few things that potentially can be helpful. How about other hormones? Okay, DHEA. So DHEA is, you can buy it over the counter at most, health food stores. You can get actually DHEA. The potential problem, DHEA can stimulate different hormones. It's unfortunately, there's no way to predict which hormones it's actually going to stimulate more of. And if you end up, you're a man, you're stimulating more estrogen, progesterone, it's like, well, that's not very helpful. But if you're a woman, you're stimulating really high testosterone levels, that may not be really helpful either. So it can stimulate increased testosterone, but again, there's really no control there. It's kind of a pro-hormone. It kind of it'll go into multiple different directions or different pathways. And so subsequently, it's a little harder to control that. All right, well, then there's some herbal things that typically when you see these components that are sold, which we'll talk about here in a minute, that they often have some herbal things in that can potentially help with growth hormone release. Now, other things that are going to help with growth hormone release is avoiding certain things too. What do you avoid? Avoid alcohol, avoid caffeine, sugar, as well as milk products. So by avoiding these things, you may actually improve your growth hormone release. Now, there are certain things that actually inhibit growth hormone. Carbohydrate inhibits growth hormone. So literally a low-carb diet, ketogenic type of diet, probably helps with growth hormone release. Stress, also, when I really may say stress, it's going to be poorly controlled stress. It's more of how do we react to stress in our life. Because when we have their stresses increase there in our lives, and we have poor reaction to it, cortisol levels go up. And cortisol also inhibits the release of growth hormone. As we talked in the past, stress also increases insulin levels. Poor sleep also increases insulin levels. So it kind of negatively affects our overall health. So what can we do in kind of improving growth hormone release? There are some commercial formulas out there. They tend to be really expensive. Okay? They usually have some herbal things in with some amino acids, some extra vitamins, some quote proprietary blends. So certain examples you may see advertised: Serovital, Secretropin, Pro-HDH, Symbiotropin, Aminotropin 6. All of these are different names for basically something that they're going to stimulate release of your own growth hormone. Now, the real question is, do they work? Actually, they do tend to work in really young people. Just the young people aren't the ones that need it. Okay, so it tends to work really well in people who are not growth hormone deficient. Okay, so is it worth trying? Well, okay, let the buyer beware. I guess that's the point there, is that it tends not to work so well the older we are. So for people that make growth hormone really efficiently, young people, young adults, it actually can work very nicely, but they don't need it. Those of us, as we get older and we could benefit from this. Is it really going to be that helpful? Maybe. Again, let the buyer beware. Expensive stuff to see minimal results with it. But obviously there are people out there who swear by it. They may have plenty of money to buy this stuff and use it all the time. And potentially, it could be helpful. Well, I'll also say, it works better than anything is fasting. Fasting doesn't cost a darn thing. It actually costs less money because you don't spend money for food. Okay? So it actually saves you money. So in summary here, kind of talk about kind of a growth hormone here, which is a really interesting hormone, gotten a lot of, I say, negative publicity, but there actually is positive things that can come with it. It's just that because it's always been referred to as a performance enhancing drug, or PED in the sports lingo, is that it's really frowned upon out there. But could it really be kind of that fountain of youth? Well, bottom line is most of these questions are really unanswered. But optimizing growth hormone is probably not a bad idea. Anything we can do, which is going to be all those things we just listed, from potentially extra B vitamins, low carb diet, get your protein in, get your rest, controlling stress, all then fasting actually works better than anything else. Okay? So optimizing growth hormone may be helpful in your overall health, actually helpful in slowing down aging, as well as weight loss. All right, questions. I don't see any questions out there, but it is kind of an interesting hormone. We talk about most hormones throughout the year sometime. And this is one that kind of gets a lot of, I don't know if it's negative publicity out there, but because there's a lot of misunderstanding out there, is that, okay, it's really not talked about too much because of the association in a negative way, especially with sports. All right, if you think of questions, obviously you know where to find us. Give us a yell here at the Center for Weight Loss Success. Email again, success@cfws.com. Phone number 757-873-1880. Should be stopping by, of course, recently with all this viral talk out here. You need to probably hold on and just stopping by in most places. But anyway, that'll slowly die away, I hope. And so subsequently get your body checked, body comp checked. Make sure you're losing fatty tissue, not losing the lean body mass. You should be receiving the weight loss tips as well as weekly recipes. Tune in each Tuesday, 6 o'clock for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good evening, everyone. Take care.